The Jessie Mae Home is a residential assisted living. Essentially that means we have a residential home that we provide assisted living services in. We specialize in Alzheimer's and dementia care. However, we have found that a lot of people needing senior health care choose us because of some of our obvious benefits, which would be the home-like setting, and then our caregiver to patient ratio really sets us apart from some other models of care within healthcare. When we say home-like environment, we truly mean home-like environment. We are in a residential neighborhood and home.
I chose the Jessie Mae Home for my mom because we had toured so many different facilities, probably about 15 of them in Columbus and Franklin County. From really large facilities with all levels of care to small settings. And the setting my mom was at before the Jessie Mae Home, they weren't able to meet all of her needs. She needed more assistance and more one-on-one care. And the administrator of that previous facility suggested the Jessie Mae Home. I would recommend the Jessie Mae Home to other people because it's such a small setting and you have one-on-one attention. It's like a small family and you don't get lost in, 50 other patients.
We started the Jessie Mae Home because I wanted to pay tribute to my grandmother, and she was a caregiver for my grandfather who suffered from Alzheimer's for 14 years. And for 11 of the 14 years, she was his personal caretaker, and she did an amazing job. She has the patience of a saint, and she continued to just love him and hold his hand the whole way through his disease process until she wasn't able to care for him anymore at home. And our family went through looking for a facility that could handle his type of behaviors, his disease, and they live far away from me. And so managing this from afar was very stressful for our entire family. And finding a facility that could handle his level of care was not easy. People don't have the experience in Alzheimer's, and people don't know how to deal with behaviors well. And so it became my mission to create a place that I would have felt comfortable having my grandfather in, and that would provide the type of care that my grandmother was able to provide for him for so long. And that's why I started the Jessie Mae Home.
As a nurse, when I go into facilities, different areas, and meet my clients, it's reassuring to know that at Jessie Mae, compared to other places, the care is individualized. I can ask the caregivers at Jessie Mae, what the person has been doing the last 24 hours, and that's very important as far as healthcare goes. And all the caregivers absolutely know what the client has been doing. A lot of times in other facilities, the nursing staff, healthcare staff versus patient ratio is way high. And at Jessie Mae Homes, it's no more than 5 clients to one or two healthcare providers. And that's such an important thing because they can actually spend more time with the person and let them know what actually is going on with them, rather than, they've been okay. It's like they can't really tell you what they've actually been doing. And at Jessie Mae Homes, they actually can let you know what the person has been doing the last 24 hours. Jessie Mae is a wonderful, wonderful place. I'd want my loved one there.
The one-on-one care, being able to work with people directly, having 5 residents versus 20 not running in and getting people dressed and off for the day. I can actually have conversations, I can have personal care, and I get to spend time and get to know the residents. That's the best part.
You know, everything we do is trying to create a situation where it feels familiar to them, it feels comfortable. They may not even remember our caregivers' names every day, but when they see the same caregiver all the time, and they don't, there's not 20 or 30 different people coming in and caring for them, but there's a small group of people, and they see those faces every day, they become familiar and they become comfortable. The whole idea of being in the home environment is to create this personalized care, and I don't see how it could be done really outside of in a facility type setting. It really has to be done in a small, intimate environment.
Within our home, we offer assisted living services, basically. We have a caregiver there that is there 24 hours a day. We have a patient to caregiver ratio, which this is, I think, one of the most amazing things about our model, is that we have a maximum capacity of 5 people, and we have a caregiver there during the day. We typically have 2 caregivers, so we have a 2 to 5 ratio, which I really don't think that you can find elsewhere. That is by far one of the largest benefits. In addition to that, I think food is always really important to people who doesn't like to eat. And we have the benefit of being able to prepare meals. When we say personalized, they are truly personalized. The times that we eat are personalized. We have some people that are early risers. They like to get up at 7 a.m. So we cook them eggs and bacon for breakfast if that's what they want at 7 a.m. And then we have some residents that maybe they don't want to wake up till around 10 a.m. and that's fine. And if they want oatmeal and they want pancakes at 10 a.m., that's what we do. We don't have a set schedule and a set meal within our environment. And so we're able to really personalize what they want, not just their care, but what they want on a day-to-day basis, which is just, it's amazing. We also, same thing with activities. We are able to offer a lot of things that other places aren't able to because of our smaller setting. We get to know our residents. We know them day in and day out. We have a lot of consistency within our team. And so they really get to know what they like and what they don't like. Especially a lot of times with dealing with Alzheimer's and dementia, there are certain triggers that perhaps will agitate them. We know how to calm people down because we know them so well. It's not like it's been 10 days since we've seen this patient or been with this patient. We are with them day in and day out, and it sets this model apart from others because we have that intimate, personalized care that other places just aren't able to provide.